Hello, my name is Dr. Jeffrey Lin, Director of Gynecologic Oncology at Sibley Memorial Hospital, Johns Hopkins Medicine. I'd like to welcome you to our pre-surgical gynecologic oncology class, which has been developed as a program to make our patients' recovery and surgical experience as smooth as possible. Our nurse navigator, Antoinette Solnick, and our nurse clinical educator, Allison Steinberg, have been instrumental in developing this program.
Hi, my name is Antoinette Solnick, and I'm a GYN Oncology nurse navigator here at Sibley Hospital. At Sibley, it's our goal to equip you with information that gives you the most successful post-surgical outcome. We'd like to help you get back to living the life that you love and being with the people that you love the most. The purpose of this class is to provide you with helpful tips to prepare you for surgery, to give you an idea of what's involved during your hospital stay, and then give you an idea of what's involved in your recovery and how you can be successful as you recover further. While you're viewing this presentation as an online module, this class will also be offered as an in-person class. Patients who come in for class will receive a notebook with the presentation you're about to learn from, as well as forms that will be posted online, or ones that you might have already been given when you came in to see Drs. Lin or Chernovsky through our surgical scheduler, Rochelle Evans. At the end of this presentation, or after you attend the in-person class, a very brief survey will be provided to gauge your learning of this material. It's really important to get your feedback, and we appreciate your comments. Before we get into some of the more housekeeping items on getting ready for your surgery, I'd like to bring up a few important points that aren't always discussed but are so critical to a successful post-operative outcome. One of the best things that you can do as you prepare for surgery is to start to take a look at the whole self. Let's start with your diet and the thought of eating clean without processed foods. Are you getting enough protein in your diet? Proteins such as chicken, beef, pork, legumes, and soy are so vital for your body's healing process. You can start today to incorporate more protein and reduce carbohydrates to help in this process. The carbohydrates that you want to take a look at reducing are the white flour or processed foods that can clog the system. Substituting whole grain breads and brown rice will give you a leg up in this effort. Are you hydrating adequately with water or an herbal non-caffeinated tea so that your bowels are moving every day? This means to try to get in 6 to 8 glasses of water every day. Keep a water bottle by you all the time to best be successful. I know that bowel movements aren't everyone's favorite topic, but I often get from patients, I haven't gone to the bathroom in more than 4 days. So this is a problem. You should be eliminating every day or every other day. If you go longer than 2 days, even before your surgery, you need to be asking yourself, am I getting a good intake of water? What kinds of foods have I put into my body today that might be clogging my system? Those are the first 2 things to look at. But sleep, stress, exercise also come into play. Speaking of exercise, what is your current routine? Right now, before your surgery, moving around, whether it be walking or running, yoga, or some other form of aerobic exercise is crucial. Think of getting ready for surgery like preparing for a marathon. What will sustain you for this long run? Moving now. Sleep, relaxation, and meditation. So let's talk about this now, because the average person gets less than the required amount of sleep. Again, taking the marathon training approach, getting adequate rest and building in time for slowing down to take care of yourself is important. There are many great meditation websites and apps for the iPhone that you can tap into. This will provide you with a non-medicating way to take 5 to 10 minutes to slow down and focus on the breath and being calm inside. I've been talking for a little while now about tough but important topics. The last one that I want to touch on is advance directives and having your affairs in order before your surgery. If you don't have advance directives, I or a social worker can help you complete a document called the 5 Wishes, or you can reach out to an attorney to begin the process. Let's talk now about some logistical aspects of getting ready for your surgery. Once you've met with Dr. Lin or Dr. Chernovsky, you also meet with our surgical scheduler. Either surgeon will be ordering the appropriate blood work, sometimes a urine culture if that's appropriate, or an EKG if you have a cardiac history and it's warranted, all to be completed before your surgery. For many patients, you may need a medical clearance to be completed by your primary care physician. The Center for GYN Oncology will need to have this completed within 30 days of your surgery. For others, you can also have a physical at Sibley via pre-surgical testing. Should you have any additional medical issues such as brain, lungs, heart, kidney, or liver, you will need to get a clearance from your specialist prior to surgery. Preparing your home for your return from surgery is also important. We've gotten some excellent feedback from you, our patients, and while not appropriate for everyone, these are just a few ideas to get you started. Prepare and freeze meals in advance. Line up any special home help you might need. Purchase an adjustment for a toilet seat and a shower chair. Set up a coffee, snack, music, and reading material station within reach of your bed. Ask one friend or family member to be your communications person. This can be somebody that you feed the information that you want others to know about your recovery, and then that person will disseminate the information to chosen friends and family and answer all of the follow-up emails. A friend or family member then to help you with getting bills paid and letters written. Making these arrangements prior to surgery can give you added peace of mind and the ability to focus on healing after your discharge from the hospital. If you don't have an appointment for blood work, please call 202-537-4437 to schedule an appointment with pre-surgical testing. You can also do this with your primary care physician during that pre-surgical visit, but it must be completed and we must receive it 5 to 7 days before your surgery. The only exception that has to be completed at Sibley is a type and screen of your blood. Please make sure that this blood work is completed at Sibley 5 to 7 days prior to surgery. You can expect a call from the testing center nurses about a week before your surgery. They will be asking you questions such as, have you had a previous surgery? And will confirm all of the medications that you are taking. This includes any supplements that you might be taking. All test results must be in pre-surgical testing at least 48 hours before your surgery. This is for your safety, so please help our pre-surgical nurses. There are a few medications that you'll need to stop taking 7 days before your surgery. Blood thinning medications that could affect your ability to clot during surgery need to be discontinued. Medications such as Coumadin, Plavix, or nonsteroidals like Motrin or Aleve need to be stopped 7 days prior. All supplemental medications such as vitamins, fish oil, ginkgo should be stopped 7 days before your surgery. If you're taking aspirin, please stop this 10 days prior to surgery. Now, I'm only speaking to those patients who do not already have a cardiac history. Should you have any heart issues such as a coronary stent or an irregular rhythm, specific instructions regarding your blood thinners will be directed by your cardiologist. The same goes for you patients with diabetes. Should you take diabetes medications and insulin, check with your endocrinologist prior to stopping these medications. Again, it is important to listen to your physician's directions on how to stop prescription medications and which medications to take the morning of your surgery, such as your cardiac or diabetes medications. The same goes for pain medications. If you're currently taking medications to control pain, please take these medications and let your nurse know that you have taken them prior to your arrival to the hospital. Normally, you will need to take blood pressure, thyroid, and diabetes medications with a sip of water the morning of surgery. Here's what not to take the morning of your surgery: laxatives or diuretics such as hydrochlorothiazide or Lasix. Please do not take these medications on the day of your surgery. Some of our patients are on hormonal therapies, so let's discuss this now. It is important to notify your physician if you're taking any hormonal therapy, including hormone replacement therapy, oral contraceptives, and anti-cancer hormonal therapy, such as Avista or tamoxifen, as these agents may increase your risk of developing a blood clot. Your physician may advise you to discontinue these medications for up to 4 weeks prior to surgery to decrease this risk. Please discuss this with your physician in advance of your surgery. Oftentimes we get the question from patients, should I bring my medications to the hospital? You always get varied answers to this question depending on the physician and the practice. But from the standpoint of our Gynecologic Oncology Center, we recommend that you do not bring your medications to the hospital. Here's why. Our hospital pharmacy provides high-quality generic and brand name medications so that you are covered. During your pre-surgical intake, you should go over all the medications with your pre-surgical nurse that is entering your current medication list into our hospital system. Should Sibley not have your medication on formulary, your personal medication will be taken by your post-operative nurse in its original bottle and entered into our pharmacy system, dispensed to you during your hospital stay, and then returned to you at the time of your discharge. You should always bring your eye drops, inhalers, and any medication the hospital was unable to provide you on the previous visit. And if you happen to use a CPAP machine, please bring the directions, as these will not be provided by the hospital. Do not bring narcotics to the hospital. The hospital pharmacy will provide those to you based on your physician's orders. Narcotics or opioids that might be ordered are listed on this slide. Depending on your type of surgery, you may have oral or IV medications. For your safety and the safety of others, it's important that you do not bring any narcotics to the hospital. Try your best for at least 3 days prior to surgery with skin preparation. If possible, shower daily for 3 consecutive days prior to your surgery using HibaCleanse soap that's recommended that you purchase. If you're unclear where to get HibaCleanse, the product can be found in the first aid section of your pharmacy. Do not use HibaCleanse on your head, face, or genitals, but do cleanse well in your armpits, your abdominal area, and your belly button and groin. Please do not clean inside the area of your vagina. Use a fresh towel after you shower, and do not use lotions, creams, or powders. We are pleased to share with you that Sibley's new tower features all private rooms. You will want to pack a small bag with items to help make you have a comfortable stay postoperatively. Packing such things as your cell phone and charger, slippers, some toiletries including lip balm and lotion, perhaps a robe, your hearing aids and glasses if you wear them, and something to occupy your time is recommended. Again, remember your CPAP machines and its directions if you use one. And we can't drive us home enough, but it's very important that you remember the night before your surgery to have nothing to eat or drink after midnight and nothing the morning of your surgery. The one exception to the rule is for diabetics. You can drink a few sips of apple juice for up to 2 hours before your procedure if your blood sugar is getting low. We recommend that you do not bring valuables. However, if needed, they can be held by your family or safely locked away in your private room once you're on the 5th floor with our new in-room safes. The morning of your surgery, you will want to bring a picture ID and insurance card. It's important that you do not shower or put on lotions or powders on the day of your surgery. Please do not wear jewelry, makeup, or nail and toe polish. I know that it's sometimes hard for us women and our toes, but this helps your nurses be able to check perfusion in your extremities. Please arrive at the hospital about 2.5 hours prior to your surgery time. Park in the parking garage, and then head to admissions for check-in. Remember, if you have advance directives, please bring those with you. Your medical information will be discussed at this time. And should you want to have privacy, please ask your loved one to return to the waiting area. There is an information monitor outside to let you know when the patient goes in or will be coming out, so you can be around to hear what the surgeon will say postoperatively. The morning of your surgery will begin on the 2nd floor. An IV will be started, and a basic physical assessment will be completed, and preoperative instructions will be given. Your surgeon and your anesthesiologist will meet you to address any of the last-minute questions or concerns that you might have, and you'll be signing a consent for surgery. This is a time when your medical information will be discussed. So, again, should you want to have privacy, please ask your loved one to return to the waiting area. From here, the operating room nurse and anesthesiologist will escort you back to the OR. Your family will be waiting in the lobby on the 2nd floor while you're having your procedure. Again, there will be an information monitor outside to let your family know when you begin and complete surgery so that they can be around to hear what the surgeon will say postoperatively.
I'm Dr. Mildred Chernosky. I'm a GYN oncologist here at Sibley Memorial Hospital. I'd like to tell you a little bit about duration of surgery. As you can imagine, there's not an exact science behind this, but we'd like to give you at least some potential estimates and some information you may find useful. The duration of surgery, to the best of our capabilities, is something that Dr. Lin and I will have previously discussed with you prior to the day of your surgery. But in general, it's going to depend upon the nature of the surgery, whether it's a cancer surgery versus a non-cancer surgery, whether the procedure is being done open through a midline incision or a horizontal incision, or if it's a procedure being done minimally invasive through either robotic or laparoscopic techniques. In general, in very broad strokes, most gynecologic surgeries can take anywhere between 1 to 4 hours. As you can imagine, some of the more extensive surgeries are probably closer to about 4 hours, whereas some of the shorter procedures can be anywhere between 1 to 2 hours and even potentially 2.5 or 3 hours. Hopefully this is information that you may find useful, but please realize that these are only estimates.
You may come out of surgery with a temporary Jackson Pratt drain, in addition to an incision. All of this will be explained to you in detail as we care for you. I would like to introduce you to my colleague, Allison Steinberg, who will discuss what happens after your surgery.
Hi, I'm Allison Steinberg. I'm an oncology nurse specialist here at Sibley. I'm another layer of resources for oncology patients, outpatient as well as inpatient during your stay here. Your inpatient stay more than likely will be on the 5th floor of the new tower. Whether you have a cancer process or not, most of all our gynecologic oncology patients come to this unit because the nurses know our patient population well, and they have expertise in our post-operative care. Occasionally, however, a patient can go to our telemetry unit or ICU if it's needed. You can expect the registered nurses on the medical surgical oncology unit to be dressed in blue, with our patient care techs dressed in maroon. Physical therapists are dressed in purple, and respiratory techs are dressed in red. Should you have any needs that require one, after surgery, you will meet with our patient case coordinator. They can facilitate your next level of care, such as home care or subacute rehab if that's in your recovery plan. Whether someone goes home with home care and/or physical therapy or subacute rehab is determined in coordination with input from physical therapy while you're in the hospital. Most patients, however, go home without need for additional therapy, as you will have physical therapy in the hospital during your recovery. You can expect Doctors Lynn and Chernovsky to round on you daily. Rounding ensures that you and your family are informed and that nursing and the entire care coordination team are on the same page as the physician. Please appreciate that Doctors Lynn and Chernovsky do not have a set rounding schedule due to their varied surgical times. Once they arrive on the unit, however, they will find your nurse, and then the team will meet together with you and your family if they are present. There is always a possibility that you will come out of surgery with a drain or Foley catheter to help with your healing. This is temporary. More than likely, you will have a compression device that goes around the calves to help aid in circulation. You will also be monitored for vitals frequently. The first day post-op, you will be on narcotics to help with pain relief. It's important that you let our nursing and patient care staff help you get in and out of bed, go to the bathroom, and get to the bedside chair. This will prevent falls and keeps you safe. Know that we will get you up and walking very quickly after surgery. That's where the pre-habilitation of your surgery becomes so important. Being in the best shape you can be in before your surgery helps immensely with this process. We want you up and moving as soon as and as much as possible. Getting up on your feet early leads to proven better outcomes after surgery with less complications with respect to preventing blood clots, improving your lung function, and promoting quicker return to normal function of daily activities of living. The days following surgery are called postoperative days or post-op days. Daily blood work starts early in the morning. Your IVs will be checked, fluids will be replaced if needed, and your dressing and incision care will be completed by the nursing staff. Again, we'd like you to be out of your bed to the chair, walking in your hallways, or practicing stairs as soon as is possible. Remember, your goal is to walk 6 times daily. The more the better.
Hi, my name is Myrna Henriquez, and I am the charge nurse for inpatient oncology. Managing your pain is our #1 priority. Our staff will do hourly rounds. During that time, we will assess your pain. Each time, we will ask you to rate your pain, 0 being no pain and 10 being the worst pain. Following a laparoscopic or abdominal pelvic surgery, you should expect to have some degree of pain in your abdomen at your incision site for up to 4 to 6 weeks. Most people feel like themselves, that is, what they feel like before surgery, between 2 and 4 months. Please limit any strenuous activity over the next 4 weeks. Avoid lifting anything over 15 pounds and limit household duties until your follow-up appointment with your provider. You may gradually increase your activity over time, but please keep in mind the total healing time for surgery typically is about 2 to 8 weeks. For most women, you will feel back to baseline anywhere from 2 to 4 months. The medications prescribed to you after surgery should relieve the majority of your pain, but you should expect some generalized discomfort that in most cases will improve daily. Whereas initially you may have a need for narcotic pain relief, you will want to start transition to non-narcotic medications as soon as you can. You may experience menstrual-type cramping for up to 2 to 6 weeks after laparoscopic or abdominal pelvic surgery. This is normal and can be alleviated with ibuprofen, for example, Advil or Motrin, or Tylenol. Generally, we recommend taking 600 milligrams of Advil with food, then tapering down to 400 milligrams. Each Advil tablet is 200 milligrams. And remember, taking Advil with food prevents gastritis or ulcers.
Blood thinners may be prescribed, but it will be determined by your physician on a case-by-case basis. This may be something such as taking Lovenox for about 4 weeks or longer after surgery to prevent blood clots. Again, this is not a standard modality and will be determined by your surgeon. If you've had a hysterectomy, vaginal or cervical surgery, you will experience normal minor vaginal bleeding, which can sometimes include small blood clots. This is completely normal, and in a week or two, this will turn into a yellowish discharge. Your bleeding should be no heavier than a menstrual period, however. You may pass occasional blood clots or experience vaginal spotting or bleeding for up to 8 weeks after your surgery. Don't be surprised if bleeding increases temporarily as you increase your activity level. Again, this is normal, but do not be excessive in your activity. Remember, you're healing. There's no need to call the office if minor bleeding of this nature occurs. However, if this bleeding is very heavy, and by this I mean soaking through a pad every 30 to 60 minutes, or if there is severe vaginal pain that occurs with bleeding, please call our Gynecologic Oncology office immediately and go to your nearest emergency room, as this is a medical emergency. Urinary frequency, retention, or having a burning feeling a few days after surgery is completely normal. This is often due to minor irritation from the bladder catheter or from the surgery itself and will resolve over time. What will help you immensely is drinking plenty of fluids. If these symptoms persist after 2 to 3 days, or there are fever, chills, or abdominal pain present with these symptoms, please call our office, as you may have a urinary tract infection. The inability to void after 5 to 6 hours, despite having an urge to urinate, is also not normal, and you should call the office immediately if you experience these symptoms. Bowel functions, or a BM for bowel movement, is a very important topic we discuss with our patients and is something I mentioned to you at the beginning of this presentation. Having a BM daily before your surgery is important. However, postoperatively, you might not have a BM for at least 3 to 7 days, and this is completely normal. Our goal postoperatively is to get you passing gas first and then have a BM as soon as possible. How can you help make this happen? Getting out of bed to chair, walking the hallways, practicing stairs with physical therapy, and getting adequate amounts of fluid into your body. Your intestinal tract will need help waking up and need help to work against the narcotics for your pain relief that slow the bowel. You can best meet this head-on by early ambulation and proper hydration. The days after surgery, constipation can be common. If you feel constipated, such as you haven't had a bowel movement in 2 to 5 days, or have gas pain, try taking a laxative, such as milk of magnesia, Miralax, or try warm prune juice to help stimulate your bowels. All of these products are non-prescription and available to you over the counter. If you have tried all of the aforementioned products and you've had no success, please call our office so that our nursing staff can help you. If you have had a bowel resection and repair, what we call an anastomosis, especially if a part of your colon or rectum were resected and put back together, Please avoid suppositories and enemas. It is important that you put absolutely nothing into your anus or rectum. Lack of appetite is very common after surgery. As I've mentioned, it may also take some time before your bowel habits regain their normal activity. Pain medications, especially narcotics, will slow down your bowel function. I know that I've been sounding like a broken record, but I can't drive this point home enough with regard to bowel function and constipation. What do I mean when I say try to eat a balanced diet? Well, try not to eat processed foods, TV dinners, or quick frozen meals. Also, avoid overly greasy and fatty foods as they may increase discomfort. Make sure that every day you're including adequate amounts of protein to promote healing, steamed vegetables, and whole grains. Stay away from white flour, which will constipate you. Drink plenty of water, and as you become constipated, consider incorporating pitted fruits, like prunes or prune juice, peaches, pears into your diet, as they promote soft stools and have a laxative effect. Eat frequent small meals initially until your bowel habits return. Please remember this process is gradual. Remind your loved one that this is the case also. You don't want to rush transitioning a diet because what can happen is a bowel obstruction. This opens up a whole nother clinical pathway. Incision care is very important as far as your postoperative process. Please avoid taking baths or getting into a hot tub for 6 weeks after surgery. We ask this of you so that infection is not introduced into open healing wounds. It is okay, however, if your incisions get wet. It is okay to use gentle soap and to allow warm soapy water to run over the incisions, just not to immerse yourself in the water. Gently wash your incision in the shower using your fingertips to carefully massage the area to promote healing. You may also want to use a soft washcloth and then pat dry with a towel. Avoid any vigorous scrubbing around the incisions. For incisions closed with staples, staples are most times removed at the first postoperative appointment, which can be anywhere from 12 to 16 days postoperatively, depending on a patient's size and their wound healing process. Once staples are removed, then what is called steri-strips will be put into place. These strips are a lot like Band-Aids and will fall off on their own, usually within 1 to 2 weeks. For incisions closed with sutures, these are self-dissolving stitches. Please keep these incisions clean and dry. Please do not use any antibiotic ointment or hydrogen peroxide. You may feel the stitches poking out of the incision after 2 to 4 weeks. This is completely normal, and it'll go away. If you are discharged from the hospital with a wound dressing in place, it can be removed the following day. Place a dry gauze using minimal tape over the incision to prevent from rubbing or irritating the incision. In some cases, a wound dressing needs to be changed on a daily basis. You will receive instructions in this regard, or if you are unable to manage it by yourself, a case manager may be able to arrange home care to assist with dressing changes. So we're nearing the home stretch of our program. Let's talk now about resuming normal activity. For most laparoscopic robotic procedures, it is recommended that one not drive at least 1 week after surgery, or as long as you're taking narcotics. After an abdominal hysterectomy or surgery performed through a large abdominal incision, we recommend not attempting to drive for 2 or more weeks. With regard to sexual activity, please get the okay from your physician before engaging in any sexual activity or placing anything in your vagina. Anything in the vagina, whether it be sexual activity, early intercourse, or tampons, is not allowed, as this may increase your risk of infection or disrupt your vaginal incision. Any additional concerns? We'd like you to call the office Monday through Friday, 8:30 a.m. to 4:30 p.m. at 202-243-5295. After hours, weekends, holidays, you can contact the physician's answering service at the same number, 202-243-5295, with any of the following. If you have fever of greater than 100.6, if you have severe pain that's not controlled by the pain medications that you've been given, if you have persistent nausea or more than one episode of vomiting or an inability to keep any food down, if you have burning and frequency with urination that persists more than 1 day, and/or occurs in conjunction with fever, chills, or abdominal pain, this is reason to call our office. Additional concerns, such as moderate, severe shortness of breath, or one-sided calf or ankle swelling pain, severe abdominal distension, or a painful or beefy red incision, or copious or foul-smelling drainage from the incision, could also indicate an infection of the skin. This is another reason to call our office. So just to recap your discharge planning, staples are often removed 8 to 14 days postoperatively. We will give you instructions on this. For open procedures, post-op appointments with Drs. Lin and Chernovsky usually occur about 2 weeks after your staples are removed. For laparoscopic procedures, post-op appointments usually occur about 3 weeks after your surgery. Possible follow-up specialty appointments might be needed. An example of this is with your medical oncologist or your radiation oncologist. We will let you know at the postoperative visit. We thank you for viewing and listening to this presentation, and I hope that it's been helpful to you and your family. It's our goal at Sibley to create a successful outcome for you with your gynecologic oncology surgery. Feel free to email me or my colleague, Allison Steinberg, with any further questions or concerns that you might have. Our contact information is listed on this slide. We would now like you to complete a brief survey to gauge your understanding of this material. Thank you again for your participation.